Hi everybody, there's a couple of people in this, a couple of patients I should say, sorry, in this compilation, and all three of mine. So
I didn't do it on purpose, guys. No. Our storage device that I store the things on has wiped every single video I've edited for myself, so it's all Taylor at the moment.
Look at this one. Yeah, we've got this, I can't even know how to describe this, to be honest. It's like a thick, almost kind of pre-keratosis obturan style kind of skin and keratin, wax. There's a bit of everything in this one.
It's like a crumbly wax wrapped in thick dead skin, isn't it?
Yeah, so we've got the standard size Zollner tube here. Just gently going around the edges to try and just peel it all the way. We already know at this point it's not going to come away easy for us, so we're going to...
No, that's not going anywhere, is it?
No. Oh, hiccups, excuse me.
It means you're growing.
I hope so.
Yeah. That's the guns again, Taylor Green.
I know.
It's the guns again.
I meant like growing taller.
Oh, I just grew wider.
Yeah, look at this one. You can see just how pink the ear canal is as well.
I think it all hinges on that thick bit of skin. Once that comes out, is that anchoring a plug, or is it just a load of more squishy, crumbly stuff hidden behind it, isn't it?
Well, it looks like that whole piece at the back there wants to start moving. There's like that bit there. You can see that the whole thing is like wobbling a little bit as they just touch up against the front.
Just see that's kind of top right section was having a little bit of a wobble.
Yeah, and I just try and get this up my way.
It's thick, isn't it?
Yeah. Got the fine end to clear these little bits.
You can see the lip of dry skin. If you look in now, it arcs from that right hand side. It goes all the way around the top.
Yeah, I think that's what I'm looking at here now. I think that's why I've switched over to the fine end here, just to try and get a better grip on this little bit of skin on the side. Oh, it's just peeled away. So maybe that might be it for the skin. Hopefully it's just a plug of wax now. Trying everywhere here. Yeah, you can see it wants to go.
A little bit more solid at the back end, isn't it?
Yeah. Cool. I think the problem we've got here is that the ear canal just in front of the recess there is quite prominent, and I think this wax is kind of just going around the side, and it's just almost hooking itself in place.
Yeah.
Oh, you can see it's all at the top there as well.
Yeah, you got a big tilt on the patient there, haven't you?
Ooh.
Jinx.
Oh, here we are. You can see this looks like it's actually going to roll. Yeah.
It's rocking, isn't it? Oh, is he going to go?
It's almost like I need a stronger grip, but I know my standard tube is probably not going to get there at the moment. I need to just move that a little bit more.
The angle's just slightly off, isn't it? To try and get that suction grip at the top there.
That's all I'm trying to do here is just pull this down so I've got something to grip onto. I don't think this is going to come up with a fine end. Ooh, I've got a little bit of a sort of a flat edge there now. This is back to the standard tube. Ooh, bit of a flinch from the patient.
Oh, that's nice. That's nice. That's what you wanted to see. That, but that bottom's not moving.
Yeah.
Spoiler. Sorry.
I can't actually remember this, to be honest.
That top it almost looked like that top section just peeled off and left the bottom section in place.
Left that bit. Ooh,
yeah, you can see that dark,
moving.
dark piece just in that little kind of cubby right at the bottom there. It doesn't seem like it's shifting.
Of course, a bit of a messy one this is. It's a weird consistency. It's like very difficult to get a grip on normally, but it's just breaking little tiny bits away.
Like sometimes you pull it all the way down, but a lot of these you'll find that the suction tube pretty much just stays in place. And then you're bringing it forwards and you don't get any further than you originally did, and it just keeps breaking these little teeny tiny bits off. Oh.
God, it's just getting it past again, that where it just kind of narrows and opens back up again slightly.
Just a bit of a heads up, guys, because most of my videos didn't end up. Oh, hang on. as I was going to go. Didn't end up. This will be the last one for me, Mr. Taylor Green, probably till about Wednesday next week. It'll just be me for the next couple of days, so Monday, Tuesday.
Lucky you.
I know, there you go. just so you got that. I'll be recording that one soon, I'd imagine. Once I've found those videos that have disappeared off my computer.
Sitting in the corner of a little file somewhere, and they're like, "Can't find me."
They forgot about me.
Yeah.
I was gutted as well because there was one that was about 7 minutes long in there. There was another one. There was another really good one actually. That was from a follow up, and I think that was some like 12, 14 minutes long. Yeah.
Oh wow.
So I'm a bit gutted. That one's just vanished into the ether.
Oh come on, it's almost there. You can see every little wiggle we do. You can see it is starting to budge a little bit.
Still got that thick layer of skin in there, isn't it?
Yeah, not an easy one. Yeah, that's looking pretty good. Looking a little bit agitated, I should say. It's a bit of a tricky one to try and clean all of this up here now, because there are little patches where I just don't want to make it uncomfortable for the patient. So we're going to take away some of these little bits that are kind of sticking up.
This patient needs some ear calm and followed by some olive oil, don't they? Really?
Yeah. It's a tricky one because you don't know whether there has been like a recent ear infection, maybe a couple of months ago that they might have used, drops for. They usually tell us, to be fair, at the beginning of the appointment, but nothing was mentioned. So I'm assuming that wasn't the case.
We got
pretty much the same on this side.
Tropical in there, isn't it?
It almost kind of looks like the stronger drops, like the hydrogen peroxide type drops, have been used here, but then only for a short amount of time, and then stopped, and it started to melt, and then it's just kept that block in the middle. Yeah. That's kind of how it looks.
I had a lady through earlier, and she'd used bicarb for no more than 7 days, and there was this sort of thick underlayer of skin, and then this softer layer of wax, and then this sort of what was originally soft wax that had re-solidified over the top. Yeah, it was like a custard cream.
I like custard cream.
I think that's probably my favourite biscuit.
It's up there.
Yeah,
it's up there.
Have we got a favourite?
Hobnob, chocolate hobnob.
Oh no.
No, not for you.
Can't dunk a hobnob.
Can you?
No,
I can.
I don't.
Yeah.
I find they disintegrate. And the chocolate goes all. I see, I don't like claggy chocolate, do I? Like
you're dunking for too long.
I'm overdunking.
You're overdunking. You got to take that little bite and then just dip it in for a second or two, so it just absorbs a little bit.
Oh, okay.
And then the chocolate like melts a little bit. Then.
Yeah. Crunch creams. There's a couple of different ones. There's a ginger one. Oh, I love that.
Oh, I know you're on. Yeah. I know you're on about.
Bit like a custard cream. Yeah.
I know.
Oh, that's a biscuit of choice, Salisbury. Sorry.
Excuse me. It's quite funny that all of that we removed, and then it's just come out with this one little centimetre blob.
Now this is. I think the title of this one was Cotton Bud Jaw Pain.
Yeah. Patient admitted straight away to using cotton buds, and you can kind of see why there was a bit of discomfort.
Oh God, yeah.
Yeah, patient has, to be fair, been using a bit of oil after booking an appointment. Usually with pieces like this, it's come away already straight away. With little pieces like that, if they dry up and especially if it is really hard, you will get that pain, and it's usually around underneath the ear, down the side of your jaw, and that's basically what this patient was experiencing, and I was quite happy it came out that easy, to be fair.
Yeah, God, yeah.
What was another one?
Another one of yours, balance issues, this one.
Oh, balance problems. Yeah, we can
just like Taylor's PA. I just feed him stuff and he just does that. So that's what this one is.
So yeah, this patient actually attended the GP, having problems with balance, dizziness, sometimes a little bit of vertigo, short bursts of it, not for like prolonged periods of time where they're like sick with it, because the vertigo can get quite nasty for some people. But This, basically the doctors looked inside the ears and said your ears are absolutely chock-a-block. They wouldn't have said it in those words, but they basically would have said your ears are full of wax. Get those cleared first. It can help certain patients with their balance, because again, especially if only one side is really blocked up, you know, they kind of start leaning more towards the better ear, the one with the better hearing. It's a bit of a messy one. It's quite hairy in there as well.
It's further in though is squeaky clean. That is a lovely eardrum, isn't it? Look at that.
Absolutely fab there. Just trying to pick up some of these last tiny little bits. So we would have always, we'd always say to the patient, you know, if, you know, clearing the wax out, if it doesn't solve the problem, get yourself booked back into the GP.
Yeah. A lot of the time GPs won't refer on unless they can see a nice clear eardrum. The thing is, there could be, you could have like an extreme middle ear fluid case or something like that, you know, otitis media with effusion, that can sometimes trigger some sort of balance issues off if it's in its extreme, or, you know, middle ear infection and stuff like that.
This one is not fully blocked. You can see the eardrum at the start there, but we're going to clear this up anyway. Just so the patient's got, you know, two nice and clear sort of ear canals. Yeah, it's a bit of a tricky one with the balance. We can't guarantee that it will fix the problem.
No.
Like I said, most of the time it does. It can help with it, but
it's thick.
Yeah, there's like almost like a little.
I could just see the red spot in the middle of that.
I think someone's been using something to try and maybe
crayons.
Might be a bit of fluff on their jumper or something. Maybe.
Yeah. Oh, that was a bit like that. Remember that weird one you had that was. Neither of us could work out what it was. It was like a ear dust bunny or something. Yeah, that was a bizarre one.
A strange one. Hairs.
Or hairs.
Oh, come on. It's these little ones I don't like.
Yeah, like that. When you get there's a name for it now. When you get the quick peels on the side.
Yeah.
No, hangnails, where your nail is split in there.
I think so.
I don't know. I think it's like an Americanism, a hangnail. I'm not too sure what that means.
Let us know.
Let us know in the comments.
I'm sure you will anyway.
Yeah, you better know ours. But yeah, when you get that kind of with the quick on the side that peels. Inch.
Yep, 2.5 centimeters on that one.
Well, guys, thank you very much for watching our video today. If you do enjoy the videos, don't forget to like, heart, share, follow, and subscribe. If you thoroughly enjoy the videos, you can also consider becoming members of the channel. That way, then you can hear about my meet with Sean Paul recently. It
was a good one.
It was a good one. Yeah, other than that, guys, thank you very much for watching. As always, take care of yourselves.
Take care of your ears.
And take care of one another, and myself and the lovely Mr. Taylor Green. We'll catch you again real soon. Bye, everybody.
Bye, everyone.